Good morning, good afternoon, good evening, whatever time, wherever you are joining for this video blog. I appreciate you for taking some time to join with me today. We're going to cover some fertility care options at Missouri Center for Reproductive Medicine, MCRM Fertility, and the financial considerations, as fertility care and finances definitely go hand in hand together. My name is Dale Bader. I am the marketing director at the Missouri Center for Reproductive Medicine, and I want to introduce you because I, like you, are one in the 8 in the United States couple. When we look at couples, there's the now projection of 1 in 8 U.S. couples are suffering from infertility. And my wife and I, well, we went through it as well. We both suffered from male and female factor infertility. And it was about a decade ago when we went through it. So I understand the emotional, the physical, as well as the financial burden, thoughts, scares that you are going through. And so that's the reason I wanted to put this together. I want to help try to remove some of the anxiety related to the financial end, because unfortunately, you can't remove that from the fertility treatment process. They are integrally tied together. But here at MCRM, we try to do our very best at minimizing that impact on you. And I like to introduce myself to patients. So when you're in the office, feel free to say hi to me. You can even ask me for the latest weather forecast. My background is I am a meteorologist by trade. But when the opportunity came to where I could give back as a previous patient, I'm so blessed to be now part of this MCRM fertility team. The cost of fertility care, I'm not going to sugarcoat it. It costs several $100s to several thousands of dollars, depending on the treatment type that you decide to choose. And we offer a multitude here at MCRM Fertility of treatment types to try to help fit into individuals' circumstances. We don't use cookbook recipes here, basically. Every treatment is personalized to every individual. And not everybody needs the same type of treatment. And even when they're in the same treatment type, the protocols can change. So it may start out as simple as timed intercourse with ovulation induction. And that you're looking at only a few $100s. You might be a perfect candidate for that. You might be a candidate for an intrauterine insemination or IUI. And now you're starting to creep up closer to that $1,000 mark. Once you start to look at in vitro fertilization or IVF, it can be from just a few $1,000s upwards to multiple tens of thousands of dollars. Here at MCRM Fertility, we have several treatment packages. One way to help break down that anxiety is not nickeling and diming, but including everything as an established package. And that helps out so that you know exactly what the final cost structure is going to be. And so we provide you that up front, starting with our silver IVF package, going all the way up to our ARCH Assured Reproductive Care and Health package, which is an assured program where there is guarantees of return of your investment if you're unfortunate to not be able to become pregnant. So there's a wide variety, and it's designed to assist you. Maybe you're interested in third-party reproduction using a donor, whether it be a sperm donor, an egg donor, a surrogate, or maybe a combination of. But don't forget there's other costs involved. There's the medications. And unfortunately, we are not able to control those medication costs. That's controlled by the manufacturers and the pharmacies. We see a lot of patients that travel multitude miles to come for treatment, and they may have to stay overnight. So there's travel costs, there's hotel costs. Those are all things that you need to consider when planning the cost of your fertility care. How can one do this? Excuse me. You need to shop around. Just like anything else that you're going around to buy, you need to shop around and compare what you're looking at. Compare oranges to oranges and make sure they're oranges to oranges, not oranges to apples or oranges to tangerines, because there are differences. Does the package include ICSI? Does the package include IMSI? Those are some of the differences. At MCRM, everybody gets ICSI. Everybody gets magnified sperm selection. And most cases, that's not the case. Assisted hatching is another item that we offer that other centers may charge extra for. So you need to look at these things and make sure you see exactly what's included in the packages, because pricing may not be the same across the board. Find the best value. Find what you're getting the most for your money. Look at success rates. Now, I'll be cautious. Statistics can be kind of hidden behind a screen, so be cautious about it. But the Centers for Disease Control keeps statistics out there that you can compare, and those statistics are easily comparable on a one-to-one basis. Have questions? Ask your healthcare professional. They can help clarify some of those statistic information. But that's how you can start to really find out where the best value is. And once you've done that, then you need to determine the course of payment that you're going to be utilizing. And maybe it's going to be one form, maybe it's going to be another form, or maybe it's a combination of. But typically for fertility care, the majority is cash pay. Unless you're lucky in one of the mandated states for insurance coverage in the United States, which I'll cover in a little bit, most of this is going to be under the cash pay system. You might be lucky though. You might have that insurance coverage. We're seeing more and more of that. And right now I would say roughly 70% is cash pay, 30% is insurance pay, and then there's a combination thereof in between. Look for discount savings programs, both on the treatment as well as on the medication. We'll cover some of that coming up here in just a few moments. Scholarships and grants are out there. I'll show you some of that as well. And lending options. Maybe you can't afford all of it. There's lending options out there. We'll talk about that as well. First, let's talk about utilizing insurance, because insurance can be one of those necessary evils. It may be a benefit. It may also be a detriment, depending on how you want to look at some things. So I'm going to try to help cover a little bit about that. At MCRM, we do review your benefit coverage before you ever walk through the door for even your initial consultation. But we still require, while we'll give you information, we'll research your benefits, you still should know your own diagnostic, treatment, and medication coverage. That way, if for some reason we find something that might not exactly meet what you're thinking of, we can work together as a team to help find that. Not all centers are going to research your benefits beforehand, so you always need to make sure that you're prepared and know your insurance coverage. We try very hard to assist patients in at least getting the initial steps covered under insurance. It's not always possible, but in most cases it is. And that's in covering the diagnostic coverage and workup. And this usually covers covering your initial consultation, the initial diagnostic evaluation treatments, or not treatments, but workups, including some ultrasounds, looking at the patency of your tubes, looking at some blood work and hormone levels, and then reconvening to sit down with either Dr. Allering or Dr. Aubuchon and looking at what has been found through these diagnostic evaluations to determine the best care treatment of options for you and for your personal circumstances. Once that has been decided, then we start to go down. There's a why here that takes place, and that why is, can we continue to follow the insurance coverage route, or is it now going to have to branch out to cash pay? So that's really something that you need to know on the process of how it usually goes for financials. We usually can get some insurance coverage for almost everybody, but then there's usually this why. And that why may take us into how we look and see, do you have treatment coverage? So once we've decided that plan, then we need to decide, okay, is there any treatment coverage whatsoever for you under your insurance plan? Sometimes it's just for intrauterine insemination or IUI only. Sometimes it covers IUI and IVF. Some cases it covers donor and any third-party reproduction. And there may also be stipulations in there. So This is where, working together with your insurance company, we will try to find out the very best fit for you so that you're not surprised at the last moment. You also need to know, is any of the medications going to be covered? Some might, some of it may not at all be covered. There may be certain preferred medications which may require us to modify the treatment protocol for you so that you get those certain medications. And there may even be certain pharmacies. Maybe it has to be mail order. So all that information will be gathered up. We'll work with you to help find that information out. There are 15 states in the United States that do have a mandate for infertility coverage. Those include Arkansas, California, Connecticut, Hawaii, Illinois, Louisiana, Maryland, Massachusetts, Montana, New Jersey, New York and Ohio, Rhode Island, Texas, and West Virginia. Each state has their own unique mandate structure, so you need to know what that structure is. You need to know what the loopholes are. One of the big things typically is these have to be fully insured plans, not self-insured plans. And these can't be small employer plans in most of these circumstances. We'll talk a little bit more, since we're located here in St. Louis, about the Illinois Family Building Act here just in a moment. For those of you that may live in other mandate states, to look up some of that information regarding the mandate specifics, I would recommend you go to the Resolve website, and that website is right there on front of your screen. It's a great resource to go to, which talks about the different mandate state plans, gives you some idea of what's covered, what the loopholes are, and so that's a great resource for you to be able to access. The Illinois Family Building Act. It entitles most Illinois residents some fertility care coverage. But again, there are loopholes. My wife and I, we were Illinois residents when we went through infertility treatment and care. Unfortunately, both of us, while insured, fell into loopholes. So we did a double whammy. Neither one of us was able to take full benefit of the Illinois Family Building Act. But for those who can, this is a wonderful option for you. You have to have a fully insured plan to be part of this, and your plan has to be for a group larger than 25. You have to have proof that you've tried to conceive for a year or more and have not been able to conceive, or you're just not been able to sustain a successful pregnancy. So these are options that have to come from your physician. You have to be diagnosed with infertility, and you have to have gone through 1 year medically supervised treatment like IUI. Now, there are some circumstances that can get around that, but that's generally the basics. What's covered? Diagnostic testing, IUI and IVF with ICSI, and your medications. So if you can be covered under this Illinois Family Building Act, you're in really good shape. The associated costs are also covered, which include donor egg and donor sperm. So that's third-party reproduction coverage. Medical expenses related to that third party. The egg and sperm retrieval process, if necessary, if it's needed, and the transfer process as well. So this is a really great item for Illinois residents, for those who are able to take benefit of it. Again, there are exceptions, and that's the employer plans that are for under 25. If you're a self-insured plan, if your employer has a headquarters outside of Illinois, if you work for a religious organization or institution, if you previously had sterilization and not attempted reversals, or if you've reached the lifetime max. So those are some of the items that you'll have to watch out for. For additional information regarding the Illinois Family Building Act, where I did not necessarily cover it here during this presentation, I would strongly encourage you to go to the MCRM Fertility website, go to the new patient section, and go all the way down to insurance acceptance. Down there, you can go to the Illinois Family Building Act, click on that, and a lot more information is provided to you right there at your fingertips to help go over, again, what is covered, who is covered, where are the loopholes, and then if you have additional questions, you can always contact MCRM Fertility at 636 778-9899, and we'll also help dig deeper for you and answer those questions and try to get the questions answered to our best ability. And we may even have to reach out to your insurance provider to research some of this additional information as well. We do offer cash pay savings programs here at MCRM. So if you're going down the cash pay option, you don't have insurance coverage, we will try to find ways to help save you some money off those treatments. If you're an educator, we have a discount program established for you. If you're in the military, active or retired, we will have a discount program established up for you as well. First responders, we got a discount program established in there as well. And even medical service employees, we have a discount option program set up for you to help get those costs lower. There are savings available also for your medications. Again, reverting back to what I said at the beginning of this presentation, unfortunately, we don't cover the cost of medications in our programs, and we also can't control the cost of medications, but we can help guide you through some savings programs so that you can save on those medications. And there are discount programs available for self-pay as well as for those of you who may have insurance coverage but have co-pays that you'll have to pay on that. There's a way to do some savings. So to see a full list of these medication programs that are available, again, I encourage you to go to the MCRM Fertility website under the New Patients section. If you go on down to discount programs, this is where discount programs for cash pay is listed, but there's also the discount fertility medications that are listed. You click on there, and this is a very comprehensive list of different available programs that are out there. Again, including cash pay and paying patients that have insurance coverage. We try to list it there so that you know if this is for insured or for cash pay. Talks about the Compassionate Core program for those of you in the military. It's a way of saving 25% off on your medications right up front. And for those of you who might be suffering from the unfortunate burden of cancer and looking to preserve your fertility, we work with the Livestrong Foundation and can get your medications covered in most cases at 100% through the Livestrong Foundation. Information on that is listed as well on the MCRM Fertility website. The Compassionate Care program is a great program we offer here at MCRM Fertility. It's available for those patients. Again, 70% of them are self-pay cash patients, so this is a perfect program for you that we're able to offer you. Everyone earns a minimum 10% savings by going through this program, and that savings is on several of the drugs that in most cases we utilize in almost all the personalized protocols that we do. Discount savings can actually increase though from that 10% all the way up to 75%. And yes, I have seen individuals receive the 75%, so it does happen. The system is income-based. It does take a little bit of time. So if you're just now starting your journey or getting information, I would encourage you to go ahead and fill out the application and get the process started. Know already what you're going to be able to save on those medications. And again, you can fill out the Compassionate Care application today. You can simply do it off of the MCRM Fertility website. This time I'm going to encourage you to go over to the Patient Resources tab. Go on down to where it says Fertility Medications. And here under the Fertility Medications tab, we're going to have the information on the discount programs as well as how-to videos. But if you hover over the discount programs, you can also get another tab open up that says Compassionate Care Program. When you do that, it'll take you right to the page where you can, right here, fill out the application and get the process started with the Compassionate Care Program. It'll take you a few minutes to complete, but in the long run, it can save you hundreds and even thousands of dollars on your medication. So I strongly encourage you to take full advantage of the Compassionate Care Program. There's a similar program called the Compassionate Core Program. With the Compassionate Core Program, if you're active military or even retired military, I do believe it is, the information again is on the MCRM website, you're guaranteed 25% minimum savings. If you are an insured individual, the same program is there's a program available to you as well. This is a copay savings card that covers the same type of medications that the Compassionate Care Program covers, where you can save up to $250 on your out-of-pocket costs. There's also a program available that you can use at Walgreens. They're one of the specialty pharmacies. There's actually a local one in the St. Louis area, but they also have national specialty pharmacies that can mail information out, the drugs to you. It's through the New Life Agency, and this helps cover medications for patient as well as for third-party purposes. You initially purchase the fertility savings card for $25. But in the mail, you will receive a $25 Walgreens gift card. So basically, it'll come out to be free, but you do need to pay for that up front. And with the use of this card, you're going to receive a $100 discount for every $1,000 on eligible purchases. And on the average, if you're looking at in vitro fertilization, a rough number estimate is about $3,500 for a single cycle for your medication costs. So right there, you're looking at a possible $300 savings just through the use of this card. IVF Greenlight is another program. It covers some of the other drugs that are commonly utilized in the infertility treatments. And there is no financial criteria required, but they do have a minimum purchase requirement. Again, more information is available on all these programs I'm discussing at the MCRM Fertility website. DesignRx is another program yet available. This is available for participating pharmacies, and it can actually save you up to $300 of your out-of-pocket costs for Follistim, if that's one of the drugs that you might be utilizing, and up to $100 on your out-of-pocket costs for Ganirelix. You do need to enroll with DesignRx, so again, information for DesignRx is available at MCRM Fertility. There are some IVF grants and scholarships that are available, and if you're interested, be ready to apply, because these timeframes come up and there's usually short-lived windows of when you can apply. But I want to give you some heads up as to what these grants are so that you can kind of keep an eye out for when the next deadlines do come around. We'll start out first with the Life Foundation grant. This is available for those of you who live in Illinois, Indiana, or Wisconsin. It helps cover the costs associated with treatment, but the request cannot exceed $10,000. So that's pretty good. That's going to cover the majority of your treatment, especially here at MCRM Fertility. For details, you can go directly to the grant website at lifefindsaway.org/grants. The Baby Quest grant is one that is awarded twice a year. It ranges from $2,000 to $16,000 and is open to all U.S. permanent residents. And you can apply again through the babyquestfoundation.org website. And information regarding these grants we also have available at the MCRM Fertility website too. And the last one I want to quickly highlight to you is the Tina Cade Foundation Family Building Grant. This is a grant awarded twice a year up to $10,000. You have to have a previous diagnosis for infertility and must be a U.S. permanent resident. There are two grant deadlines. The one in the summer is in July 1st. The spring grant or winter grant deadline is on February 1st. And the cadefoundation.org website will have more information and how you can apply. Lastly, let's quickly talk about some financing options. Maybe you just don't have all that money sitting around. I can honestly tell you, my wife and I did not either. So we had to look and be creative of how we were going to make this happen for us. We wanted to be parents and had strong desire to do so. So we had to find a way to make the financial ends meet. You can talk to your local banking institution or credit union, see if they will offer any type of financing or lending options specifically for this type of care. There are specialized lending institutions out there. Prosper Healthcare Lending is our preferred lender that we work with. We've previously worked with CapEx MD. They're another specialized lender. And there are others out there if you do some additional research. And you may have to use a personal credit card. That's another option out there as well. If you are interested in considering looking at lending options, maybe with Prosper Healthcare Lending. We have found them very easy to work with. Patients have been very happy to utilize them. And it's fast and easy to apply, and it does not impact your credit by simply applying. You can do so by going to the MCRM website, go to the new patient section. The tab will once again drop down for you, and you can go down to financing options available. When you click on that, it'll take you to the page that talks about finance options, and will show you a spot right there on the right-hand side of the screen where you can submit an inquiry and see for instant, quick approval whether or not you'll get financing and at what rates. And again, this does not impact your credit, so it's a great tool to utilize to see if this is something that might be of benefit to you. Prosper Healthcare does offer two separate options. They cover a basic option and they cover an exceptional loan program. So if you have very high credit, that exceptional loan program might even be a better option for you. But more information, again, is listed right there on the website, covering all the details regarding Prosper Healthcare, as well as the ability to quickly get a application request put in and whether or not you qualify. That concludes this video blog. If there's any questions that you might have in the future, feel free to go ahead and reach out to me. My name again is Dale Bader. There's my email and my direct phone. In fact, somebody's already ringing me right now with questions. I'll be glad to return their call here just in a moment. Or you can reach out to us at MCRM Fertility. There's our address as well as our phone number. It's been a pleasure. We look forward to helping you along your fertility journey, and we'll hope to see you soon.